Welcome to the CEO Circle set of webinars. Today we are presenting digital medical currency, and our speaker will be Kelly Whittle. To introduce our speaker, I will pass on to Roland Stacy, our chairman of the CEO Circle at the International Hospital Federation. Hello, Roland.
Hello, Marissa. Thank you so much for all you've done in preparing for today's webinar. Before we get going today, I wanted to give just a brief introduction about what brought us to this point. Several months ago, at the annual meeting of the International Hospital Federation in Taiwan, the leadership group of the CEO Circle gathered to talk about how we could be more influential in the future. And one of the topics that we had presented to us was that we could do more webinars where people could participate, and that we would record those webinars and keep them on file so people could use them through the coming months of 2018. So this is our first attempt at that, and today's presentation by Kelly Whittle will be recorded and will be available on the International Hospital Federation website for members of the CEO Circle to utilize going forward. And we're excited about that. And in coming weeks, we will continue to upload different talks and webinars and speeches that members of the Circle can use at times that feel important to them. So my goal here is to get those presentations up and running for members of the CEO Circle, and we appreciate your participation. Today, as we mentioned, is Kelly Whittle, and Kelly is a passionate strategist and an expert in change leadership, and she is the founder of Whittle Advisors, and she shares current successes through international speaking engagements and publications. That's actually how we got to know Kelly, as one of the speakers for the International Hospital Federation meetings in Taipei last fall. She was so well received that we have invited her to be our inaugural, to provide our inaugural webinar and to be the inaugural recording that we will make available to people. Her industry experience is in strategy and change leadership, solution implementation for hospitals and physician practices and specialty groups. She's been doing this for more than 20 years, and she's focused on developing business strategies based on data-driven evidence. And her clients have been recognized nationally and internationally for outstanding transition achievements. We're very excited to welcome Kelly and appreciate her effort in talking at the International Hospital Federation. Today, Kelly will be talking to us about how we can leverage digital payments to secure access to healthcare services. Digital healthcare currency provides access to healthcare benefits through retail-style financial transactions. Digital healthcare currency is a new administrative framework that simplifies the administrative burden associated with healthcare access and benefit administration. Kelly will share digital medical currency pertaining to patient identification, eligibility verification, and payments. A mobile application allows our patients to automatically load and track their healthcare benefits or their vouchers or their phones securely in order to ensure that their physicians are paid in a timely manner for covered healthcare services. We're very excited to have Kelly with us. We appreciate her time and effort on our behalf for the International Hospital Federation, and we'll now turn time over to Kelly Whittle to present her inaugural webinar for the International Hospital Federation CEO Circle. Kelly?
Hello, everyone. Good day to you all. I'm Kelly Whittle. Thank you for joining the IHF CEO Circle facilitated webinar. Today, we're going to be talking about digital medical currency, bridging the access divide. As a gentle reminder, We will address questions at the end of our time together, so grab a pencil, jot them down, or feel free to type them into that chat box during the presentation, and we will address them during the Q&A portion of our session. To orient you to my voice and pacing, I'll take about 30 seconds to share a few facts you are unlikely to know. I'm incredibly passionate about simplifying healthcare delivery in an effort to reduce cost and improve access and quality outcomes. I am founder and CEO of Whittle Advisors, a healthcare consultancy focused on transitioning our clients to value-based healthcare and technologies leveraging democratization. The good news is our approach is working. We have saved $4 billion in patient revenue to date. This patient revenue is protected from value-based healthcare and quality measure penalties imposed by healthcare regulations and payers. Many countries are instituting these value-based healthcare programs in an effort to reduce cost, improve patient outcomes, and population health. I believe as a global community, we're all connected, striving for improvements and increased access and outcomes for our populations. As such, international collaboration is really important to me. I'm a founding member of the International Society of Digital Medicine, and I typically have an opportunity to present at the international level at least once or twice per year. Global healthcare challenges include the cost of healthcare that continues to increase, our aging populations, and healthcare delivery systems that have a finite capacity. It's important to get the right care in the right setting at the right time in order to leverage the capacity appropriately. This is a topic that I don't hear much discussion of on a global level, but it is something that I'm aware that individual countries are wrestling with as they work to get care in the right location to improve access to healthcare. After all, every healthcare system has a finite capacity and must deal with rising costs. These challenges act as barriers to healthcare access. You might be asking, what is digital medical currency? In essence, it's a healthcare benefit wallet. The idea is to eliminate the confusion and complexity associated with using healthcare benefits, revealing how and if services are paid before a service is even rendered. It also includes the initiation of payment in real time. In essence, a Visa-style transaction model for healthcare. There are many benefits associated with this alignment of patient, provider, and payer. Let's take a look at some benefits for patients. There's the benefit of a reduction in missed medical bills and duplicate payments that impact access to healthcare. Another benefit for patients is improving coordination of benefits and care experience by securing real-time billing and payment options at the point of care. And finally, we're looking to leverage the technology platform that aligns current consumer expectations with their experience in healthcare, in essence, bringing a retail convenience to healthcare. There are benefits for providers and payers as well. There's an improvement in the chronic billing and payment issues associated with the 6 most commonly used electronic and paper-based processes. Many, at least in the US, are still in a hybrid electronic paper system. We're looking to remediate that, pushing electronic systems into the front line of healthcare delivery. These would include eligibility and benefit verification conducted electronically, referrals and prior authorizations, claims submission, receipt claims and status inquiries, claims payments and remittance advice. All of these transactions completed electronically. It's essential to standardize our medical claims processing, prior auth, and payment processes if we're ever going to reduce the cost of healthcare and increase capacity. Simplifying our patient, provider, and payer interaction improves transparency and reduces cost. The system is based on smart card technology that offers reliable and secure electronic medical claim processing for cardholders. Smart card is an electronic card containing a chip that's very similar to the one used in mobile phones. This chip acts as a key opening the door for personal and medical information. We're not limited to a physical card. We can also utilize technology in the form of a mobile app, providing the same functionality with additional convenience. The technology provides many features, including personal information like a national ID number for healthcare services, the patient's address, and a recent photo for identification, emergency-based information like blood type and the name of a family doctor, health insurance terms and exclusions. These are those important benefits that we're looking to unlock at the point of care. There would be encrypted medical history that ensures safety and total secrecy for every single subscriber. Recent healthcare visit and medical procedures, along with prescribed medications, can also be included in this smart card technology. The technology is used by patients as authenticated identifiers to match them with their individual medical records, to help store relevant patient information and pass admissions information on to admitting software, thereby automating the process. If we clean up just the connection between identifying a patient with their appropriate medical records, we will have increased efficiency across the board. Now, democratization is my new favorite word. It's an exciting concept that means what was once reserved for the few is now available for the many. Let's explore how this concept applies to digital medical currency, specifically data democratization, as the ability for information in a digital form to be accessible to the average end user. The goal of data democratization is to allow non-specialists to be able to gather and analyze data without requiring outside help. So why now? Well, we find that the use of smart cards and mobile devices provides a perfect environment to roll out digital medical currency. We know that 7 out of 10 US adults have a smartphone, and over 114 million have made mobile payments. In the healthcare industry, we have the fastest growing segment for near field communication, with an annual growth rate of over 20.4%. And finally, more than 200 million smart cards have been distributed in healthcare worldwide, providing access to medical records, patient information, and admission information. The healthcare industry is ready for payment reform and improved processes. Let's begin to leverage technology that's readily available in our hands to improve the process and reduce the cost. I've brought along some US data regarding the amount of money spent on the billing and insurance process. This happens to be 2012 data showing that in the United States we spend $471 billion in billing and insurance processes. Of that $471 billion, hospitals or acute care centers spent nearly $74 billion, with physician practices or medical practices spending $70 billion. These numbers are associated with 1 year of processing billing and insurance claims. By utilizing digital medical currency concepts and processes, we can simplify this financing system. In the US, we could result in cost savings exceeding over $350 billion annually, which is nearly 15% of our healthcare spend. Let's take a more granular look at these savings. Our initial research shows an opportunity to significantly improve the benefit utilization experience and streamline claims processing with measurable cost savings. The following table illustrates the estimated administrative cost savings due to the adoption of the CAQH core operating rules. As you can see from the table, it includes claim submission, eligibility and benefit verification, prior auth, claim status, claim payment, claim remittance, and advice. We're moving away from a paper and hybrid system to a completely electronic transaction set that then is associated with a digital medical currency platform. The savings are based on one-time use of the e-wallet for a covered outpatient office visit encounter, such as an annual wellness exam. With these EDI transactions in place, there's an estimated savings of $40 per transaction set. About $15 of that savings would be attributed to the payer, and $25 of that savings would be attributed for the provider. That's a significant amount of money on the provider side. You might be aware in the United States, medical practices can easily spend more than 70,000 US dollars interacting with insurance companies on an annual basis to determine benefits. These automated systems would bring improved efficiency as well as cost savings on both the payer and provider side. Now let's take a look at what we might achieve with just a 10% adoption. When we look at a medium to small coverage of about 170,000 lives, a 10% adoption would give us about $1.6 million in savings for our payer, and the provider network would average $2.2 million in savings. And again, this is a one-time use of the e-wallet. A 30% adoption of the same group of folks, 170,000 lives, would result in significantly more savings of $4.8 million on the benefit administrator side and $6.7 million on the provider network side. These results include both administrative cost savings as well as improved clinical quality reporting analytics, which I know many of you are implementing or working with already. Let's take a look at how this might work. We see here that the patient arrives with their smart card or their mobile app, their digital medical currency information. They present this information either via the app or via the card to the administrator at the medical facility. The data is then decrypted, validated, and retrieved. Once the administrator identifies the patient utilizing a photo in the card or on the app along with the person standing in front of them, once that authentication is completed, the system is then invoked to complete the registration process in the ADT system. At this point, the card is simply returned to the patient. Simple 5-step process, streamlining the entire front to back registration process. Now, once the patient has been registered, identified and registered, the PCP or doctor has some basic information that has been retrieved right off of the card. With that, where they're going to jumpstart the savings right at the very beginning of the visit. We see that the digital medical currency workflow starts with some value-based healthcare principles. There are 2 innovations that result in a sum that are greater than their parts. Let's take a look at the 6-step workflow. Now, a traditional billing process costs about 4 to 9% of the total claim value. But you look at a medical exam, like a Medicare annual medical exam for fiscal year 2016, the reimbursement is about $148. Through digital medical currency's direct billing process, that doctor could save almost $10 per exam just simply by doing this direct billing process I'll explain to you now. Once the established patient is visiting with their PCP, we've used this smart card to authenticate the identity. We've completed the registration very quickly. We eliminate the need for the patient and provider to track insurance coverage and co-payments amounts. Remember, the smart card includes that information, so there's no need for an administrator or medical assistant to be on the phone with the insurance company while the doctor is examining the patient to try to figure out what the co-payment is. Digital medical currency system verifies electronically what benefits the patient is eligible for and what their financial responsibility is. Once that copay amount has been identified, the payer will electronically verify eligibility and perform a real-time claim adjudication, including a $20, if that's the copay, directly from the member's HSA account or other linked payment source. And again, these are linked payment sources right within the digital medical currency system. On the chart, we are right between Section 2 and Section 3, where the PCP has initiated care with the patient, while the PCP is seeing the patient, the systems are communicating with the payers are communicating with the financial institutions that work with the PCP. So payments are being processed in real time. The payer sends the provider electronic remittance, again, saving money right through the direct medical currency process over the traditional billing process, which might take 5 to 7 days before a claim gets dropped from the medical practice. The PCP will electronically submit any diagnostic orders that are included as part of the service. An annual exam might include and require mammography exam or some blood work. All of these services are bundled together under the value-based principles associated with many of the transitions you're undertaking. Therefore, the patient and the PCP are managing not only the diagnostics to be scheduled, but the payments associated with those diagnostics, eliminating the need for the patient to arrive at the lab and start all over again, if you will, trying to determine how much is due for an X-ray or lab work associated with their annual exam. In essence, we've streamlined the front to back process for this episode of care, collecting payment at the point of care, at the very first point of care in the PCP's office. In conclusion, the healthcare industry can leverage digital innovation to reduce the cost of healthcare delivery. I recommend that we leverage the technological innovation of other industries to reduce adoption time. By exposing the benefit scheme at the point of care, we can reduce the barriers to healthcare access. Digital medical currency can reduce the cost of healthcare administration, improve capacity of finite systems, allowing the global community to bridge the access divide. Thank you for participating in today's webinar. We'll begin to open the lines for questions now. I've placed my contact information on this very last slide. You can reach me at kelly@whittleadvisors.com. I'd love to hear your feedback, address any questions you might have outside of the webinar. Let's take the questions now.
I have a question for Kelly just to get started. Kelly, this is fascinating. Thank you for this. As you were going through the process and how to engage billers and patient reps and others, in my mind, I had a United States scenario, and so I could follow that. Can you give an example of how this might work in another country that has a single payer system, how a hospital could take advantage of what you're saying, just so me and some others in the United States might be able to understand?
Absolutely. When I think about my colleagues in a single payer system, I find that an area of advantage for them would be in the ability to streamline the patient identification process. And often, Rulan, we'll find that even in a single payer system, there is a portion of expectation or payment that's expected on the part of the patient. And so helping to process payments efficiently when there's a copay or a shared amount that gets charged to the patient is an advantage. And the second big advantage then obviously is having that authenticated identification readily available to be accessed by healthcare providers. Now, in Taiwan, what they have done is taken it a step further. They are using some smart technologies that actually tie to their pharmaceutical database. It's a small country with a small population, but they have a single pharmaceutical database as well as a single EHR that these smart devices connect directly to, providing relevant information at the point of care.
And does this also help as payment in whatever country starts to be more centered on quality of care and payment is tied to? I'm just wondering if does this help in organizations that have reimbursement tied to quality? Does this help provide the data they need to enhance their reimbursement by demonstrating quality outcomes?
I believe that they're directly connected, especially when you think about how technology in an EHR electronic health record today is being duplicated often in our payment systems. By helping to streamline the payment process, we now have the ability, much easier ability, to audit and realign the payment and clinical data that helps to drive quality-based outcomes. Certainly, as countries define in the delivery of care.
Questions that anybody has for Kelly before I dominate all the time?
I do have a question myself, Kelly, which maybe a little bit specific to Europe based. I mean, but how do you present? How do you deal with the confidentiality of data? As you know, here in France, where I am based, confidentiality is really an issue and has been refraining the electronic health records. So I was just wondering, how do you approach it, and if you've had any insight into this?
I haven't specific experience in France or the types of challenges that you're having regarding EHR or health data in keeping it confidential. In my experience with digital payments, we have similar confidentiality laws or protections on payment-based information. And so by streamlining the process and verifying that the patient is who the patient is, requiring many mobile devices work off of a facial scan now or a thumbprint, you get closer to verifying that the data that's being shared actually belongs to the person who's receiving the care.
Thank you, Kelly. And how about guaranteeing that this data will remain safe and sound locked somewhere without the risk of leaks or simply for share for other commercial purposes?
Absolutely, that remains, always remains to be a challenge, as the data not be shared for commercial purposes or to expose individuals. And so there are practices and regulations that we have to work around to protect the data. And I think each country, Marissa, those regulations are a little bit different and would have to be taken into consideration.
Thank you. No more questions on my side, and I can't see any other requests or raised hands from any of our attendees. Maybe I should pass on to Roland to close the session.
Kelly, this has been fascinating from the get-go and very thorough, and has given me a lot to talk about. You'll be happy to know one of my colleagues is also on the line, and he and I are furiously talking back and forth about some of the great things that you've been talking about and bringing up. So thank you for being the inaugural webinar for the CEO Forum. We will, CEO Circle, we will stay in touch. Look forward to seeing you in Brisbane and see you online at the International Hospital Association. So Federation. So thank you all very much. And with that, Marissa, I think we're adjourned.
Thank you, Roland.
Thank you all. Have a good day.